Mr. Salim, 67-year male, came to us from Sudan with the complaints of pain in both the knees, long-standing pain in both the knees, and the patient was advised knee replacement at his native place. Then the patient came to us, and we did the X-ray for the patient, and we diagnosed that the patient is having advanced osteoarthritis knees. And then we have planned the bilateral knee replacement surgery with the help of the 5D robotic technique. And then we did the surgery, and the surgery was done 15 days back, and the patient is doing very well.
I can go to the bathroom. I walk about 15 meters every night, and even also 50 meters.
Okay.
And sometimes I will get down to the garden.
Okay.
I stay for half an hour, then return to the room. Okay, I'm not paying.
تتكلم في اللغة.
He is very happy. He is able to walk without support. He is doing the good range of motion from 0 degree to 100 degrees without any assistance.